911? Yeah. My friend's unresponsive. I'm at 635 Southwest Boulevard. Yeah, he's not responding. Right this way. Thanks for coming so fast.
No problem. Did you see what happened?
I came into the kitchen, he was on the floor.
Okay, sir, you okay? Sir, what's his name?
Tom.
Seems,
Tom Anderson.
Date of birth?
That I don't know.
Okay.
Sir, can you move anything? Can you move any extremities?
Go ahead, get a blood pressure, pulse, respiration, the glucose.
He's got a right-sided gaze here.
He seemed,
Okay.
he's always seemed healthy to me. I really haven't heard of any medical history.
Said he's got a right-sided gaze. Okay, we get a stroke.
Sir, can you smile for me? Doesn't seem to be responding to any.
Sir, you know what kind of medical history he has?
I'm not aware of any medical issues.
Okay, you know if he has any allergies?
Not that I'm aware of.
Okay.
You got that seat collar?
Abby, what did you get on the glucose?
86.
Okay, let's go ahead and go through our race scorecard. How's he look on facial paralysis?
Sir, can you smile for me? Let me see all your teeth. There's no response.
Okay, we'll give him a 2 on that. Let's see arm motor function.
Sir, go ahead and keep this arm up. Can you keep this arm up? Left leg. Keep this leg up.
Unable? Okay, we'll give him a 2 on that as well. Let's see head and gaze deviation.
He's gazing drastically to the right.
Okay, we'll give him a 1. He's aphasic, he's unable to speak. Let's go with Ignatia. Is he able to identify his own arm or move his arm? No.
Sir, whose arm is this?
Okay, we're gonna give him a 2 on that. And it's likelihood of a large vessel occlusion. We're gonna go ahead and call the EMS stroke hotline. Hey Doc, this is Matthew with Hollandale Fire Rescue. We have a 55-year-old male who's displaying signs of a large vessel occlusion. Is there anything else you would like to know?
Sure. So what was the last seen normal time?
Approximately 3 hours ago.
Okay. And is the patient any blood thinners?
We're unable to determine. There's no one else on scene. He's unable to speak.
Okay. What's the blood pressure?
135/80.
Okay. And what are the signs, symptoms, the deficits on exam?
He has facial paralysis of 2, arm motor function we gave him a 2, leg motor function a 2. He has a deviation of the eyes to the right. He's aphasic and agnostic.
Okay. So it sounds like he does have a clot in the MCA, and so we'll go ahead and activate the cath lab. What's your estimated time to arrive?
Approximately 5 to 7, sir.
Okay, great. Thank you.
See you on arrival.
What's coming in?
So we have a male stroke alert patient coming in. His race score is approximately 8. He's not on any blood thinners currently that rescue knows of. Last known well was approximately 3 hours ago, and ETA is about 10 minutes.
Okay, let's activate the stroke alert.
Stroke alert, station red, emergency room. Stroke alert, station red, emergency room. Stroke alert, station red, emergency room.
is a 55-year-old male with a race score of 8. Last time well seen was 3 hours ago. Blood pressure of 135/80. Glucose is 100. He has a right-sided gaze and left-sided weakness. There's family on the way.
Sir, how you doing? How do you feel? Can you follow my finger with your eyes? Can you lift up this arm? How about this leg? Can you lift up this leg? Can you lift up this leg, sir? Okay, good. How about this arm? Okay, good. All right. Looks like we have a NIH stroke scale of at least a 10. I'm going to contact neurology via StatLinks and activate the NeuroCath Lab team. Yes, neurology, we have a patient with an NIH stroke scale of at least a 10. Looks like they'll be a candidate for TPA. We're taking them to the CAT scan now. The patient's hemodynamically stable. We can bypass the bay and go straight to CT.
Okay,
Doc, let's go.
Take her to CAT scan now.
Good morning, Dr. Rosenberg. I was told by the ER physician that the patient has severe neurological defects and meets the red pathway for the CTA, carotid arteries, and brain.
Dr. Perez? Hi, this is Dr. Rosenberg from Neuroradiology. How are you? I'm looking at the CT brain of the brain attack. I'm seeing no evidence of a bleed. I don't see a large acute stroke. The aspect score is 9 or more. I do see some hyperdensity in the right ICA terminus and in the right MCA, suggesting that there is intraluminal thrombosis. So my suggestion would be to defer the CTA. Do you agree? Very good. Thank you.
Okay, we run through the inclusion and exclusion criteria for the TPA. I'm calling the pharmacy now. I need you to go upstairs and get the TPA, okay?
Will do.
What I tried to do this morning was
Ivy Room Pharmacy, how may I help you?
Hey, it's Norman in the ER. Hey, we got a stroke patient in the ER. I need you to go ahead and mix the TPA. Yeah, I sent Kenya upstairs to get the TPA, all right?
Okay, TPA coming up, thank you.
Thank you. Bye-bye.
Hey, Dr. Madden.
Good. Thanks for the heads up on this
Here's the
patient.
scan.
Okay, let's take a look. How is he doing right now?
The same, no changes.
Okay. So it looks like there's no bleed. I don't see any obvious big stroke that's established yet. And there is a clot in the right ICA, possibly extending into the MCA on the right side. So it looks like a TPA candidate, and we'll take him to the cath lab.
Yes, Dr. Maida. Okay, so it's a 55-year-old male with a large vessel occlusion in the right MCA. I'll let the team know. Thank you.
Can you squeeze my hands, please? And go ahead and look straight ahead. All right. I'm gonna have you press down on your feet and lift up on your feet. So we have some left arm and left leg weakness and right eye gaze preference.
Okay, team, thanks for setting up quickly. We have Tom here. He's a 55-year-old with an acute stroke. He has a large vessel occlusion in the right MCA. So we're going to do a mechanical thrombectomy. Duration of the procedure, hopefully less than 30 minutes. Blood pressure goes 150 to 180, no higher than 180 because he received IV TPA. No antibiotics, meds on hand.
We have neo and nicardipine.
Okay, great. And request an ICU bed afterwards. Any questions or concerns?
No,
sir. Okay, So puncture time is now. Okay, we're crossing the clot now in the right MCA, and the device is going up, and the device is now fully deployed within the right M1 MCA. Deployment time is now, and we'll retrieve in 5 minutes. Okay, looks like the device retrieved successfully. There was a large clot on it, so let's go ahead and do another injection through the catheter and make sure that the vessel is fully open. Until then, Jamerson, just keep re-prepping everything. So final run is about to happen now. Don't move, Tom. About to do a contrast injection. Okay, doing the injection. And it looks like the vessel is fully open, guys. Great job. Full reperfusion, Tiki 3. Nice work. So let's go ahead and lower the blood pressure to less than 150 with some nicardipine, and let's get a neuro assessment. Tom, can you wiggle your toes? Okay, can you squeeze my hand? Squeeze my hand. All right. Very strong grip. Excellent. Hi Valerie, how are you?
I heard there was a stroke alert. How'd the case go?
The case actually went extremely well. The patient is a 55-year-old, had complete occlusion of the right M1 MCA, and so he came in with a high NIH stroke scale, was not able to move the left side at all, had gaze preference. We got full reperfusion after mechanical thrombectomy, and he regained his strength. We didn't do any sedation during the case, and he's moving everything now symmetrically. So basically, we wanted to give you post-procedural care instructions. Do Q1 hour neuro checks. Blood pressure goal now is just normotensive, 100 to 140. And no antiplatelets today. We'll get an MRI scan tomorrow to see what the final infarct volume is. And today, flat for 2 hours from the standpoint of the sheath being out from the right femoral. And I've updated the family. The cause of the stroke most likely was cardioembolic, so we'll do a full workup with TEE as well to make sure he doesn't have another stroke. Okay? All right. Do you have any questions?
No, thank you.
Okay, thank you.